All good morning, Jagender Rana here. Topic for our discussion today is mental health care insurance. Mental health care insurance. Mental health, after years of being overlooked in India's healthcare discourse, is finally beginning to receive the attention it needs. A major milestone in this shift was the introduction of the Mental Health Care Act 2017, which came into force on 7 July 2018, replacing the outdated Mental Health Act of 1987. This act redefined the rights of individuals with mental illness and made it mandatory for health insurance policies to include mental health coverage. In individual policies, psychiatric ailments are covered by default, as all policies needs to be compliant with the relevant regulations. However, despite this legislation, a significant gap remains between policy and its implementation. Many employees are still hesitant to use mental health support at work because they are afraid of being judged or looked down upon. So while some insurers impose a sublimit on psychiatric ailments depending on the chosen plan, there are policies that cover these conditions up to the full sum insured. This contrasts with group policies, which are tailored specifically to the needs of the group. The coverage and sublimits for the group plans are determined by various factors, including budgetary provisions for health insurance, making them more flexible yet potentially less comprehensive than individual plans. With the usual age of onset of mental ailments being around 18 years, the incidence peaks at around 40 years, so thereby affecting the most productive years of human life. In India, the incidence rate of common mental disorders like depressive disorders has been around 2.7%, with a treatment gap rate of close to 85%. This highlights the huge burden of the disease and the fact that only a very small percentage of the affected seek medical advice or have access to quality health care. Interestingly, even though mental illness related claims for corporate employees account for less than 1% of total claims, there has been a notable 20% increase compared to last year. So the most commonly reported mental health conditions include autistic disorder, conversion disorder with seizures or convulsions, unspecified anxiety disorder, phobic anxiety disorder, and depressive episodes are notable conditions. So remarkably, the top three disorders have experienced a 100% increase, which can be attributed to enhanced corporate insurance coverage and a growing willingness among employees to seek help. Although the Mental Health Act of 2017 has made it compulsory to make provisions for mental illness in health insurance policies, several factors continue to limit the benefits. Taboo still surrounds mental illnesses, deterring people from openly discussing or addressing their issues. A lack of awareness about early symptoms further prevents timely intervention. Even when policies do provide coverage, Many come with sublimits as low as rupees 30,000, which makes treatment unaffordable in many cases. Also, several policies do not offer OPD cover, which is mostly the primary mode of treatment for conditions such as stress and anxiety and depression. We have seen some progress over the years through. In 2023, the number of organizations covering psychiatric inpatient care increased by 5%. However, psychiatric OPD coverage remains limited to just 7% of employers. So industries such as the IT, ITES, manufacturing and BFSI are leading the way, offering up to 50% of the sum insured for inpatient care and up to rupees 25,000 for outpatient care. Another important step has been recognizing substance abuse and alcohol addictions as mental health issues, so they get the proper care they need. Also, the new law, that is Bharatiya Nyaya Sanhita, has now fully put into effect the rule that discriminalizes attempted suicide, which is another big move forward. Given the impact of mental well-being on workplace productivity and employee health, it is crucial that organizations treat mental health as a priority. Employees should be encouraged to talk about their struggles rather than suffer in silence, and access to professional help must be made seamless. So employers can play a pivotal role by organizing mental health awareness sessions, investing in comprehensive insurance policies that cover both OPD and hospitalization, and ensuring the confidentiality of employees seeking support. Expert-led training programs, webinars, and seminars plays a key role in addressing mental health challenges and breaking the stigma of mental illnesses at workplace. So additionally, with internal communication modes at firms to share mental health resources available, awareness drives, and most importantly, employee success stories can help in building a more informed and supportive workplace culture. Not only corporate insurance brokers too have a significant part to play when it comes to mental health. So with their knowledge of industry trends and available options, brokers are positioned in a unique way to help employers design customized and budget-friendly policies that provide sufficient mental health coverage. So with their expertise, they can identify and address the disconnect between available solutions and employees' real requirements. So the conversation around mental health in the workplace has begun, but it's time to turn awareness into action. So by addressing stigma, increasing access to treatment, and providing better insurance support, Indian workplaces can build a culture where mental health is valued as much as physical health. So the road ahead demands to collective effort from employers, policymakers, and employees to create a supportive ecosystem for mental health at work. Now, with the stress escalating among Indians, there has been a 41% rise in mental health insurance searches in 2025 versus previous year. So while evaluating health insurance covers, the search was largely driven by young adults, women, and those in high stress professions, found a new survey by Policy Bazaar. Notably, Tier 1 cities accounted for 50 to 55% of mental health insurance uptake due to highest disposable income, greater access to therapists, and progressive corporate culture encouraging mental well-being. The Insurance Regulatory and Development Authority of India in March 2023 made it mandatory for general insurers or standalone health insurers to launch health insurance policies that can provide coverage to people with mental illness. So the survey that studied 7,500 claims in financial year 25 found that on the claim side there was a 30 to 50% rise in mental health related claims over the last 2 to 3 years. Most claims were for mid to moderate conditions, while chronic and severe disorders remains underreported, possibly due to stigma and a lack of diagnosis. And anxiety disorders accounted for 30 to 35% of mental health claims, while depression claims, including dysthymia, accounted for 25 to 30% for the claims. Workplace stress and burnout accounted for 20% of the claims. Insomnia adjustment disorders 5 to 10%, while bipolar disorders, post-traumatic stress disorders, obsessive compulsive disorders accounted for less than 5% of the claims. So mental health insurance claims covered therapy session, psychiatric consultation and prescribed medication. Therapy and counseling have become common uses of OPD benefits. More users are proactively researching mental health coverage, driven by a post-pandemic shift in how people value mental well-being, wider availability of OPD benefits, and reduction in stigma. Especially in urban and educated circles, this signals a clear behavioral shift where mental health is now actively considered while evaluating health insurance, not an afterthought. So analysis of first-time claims suggested that major life events often triggered claims such as the career pressure, possible relocation due to the job, burnout, financial responsibilities, caregiving for children and parents, post-retirement isolation, and health-related anxiety. Claims related remain low here, possibly due to stigma and digital barriers. Age group 25 to 35, which face unique stress such as work-life imbalance, financial insecurity, and job changes, were most likely to opt for and use mental health benefits. This cohort showed the highest search interest, policy adoption, and claims. So they were also found engaging actively with digital mental health platforms and app-based therapy tools. The study also found that women were more likely to enroll in mental health coverage. Thank you very much.